So as I engage with social media MDs online, I hear them say that finding a diagnosis such as an autoimmune disease is getting to the root cause.
In most cases, yes. Do you disagree?
Absolutely false. Check this out. So I asked this question on Open Evidence AI. What are the common causes of autoimmune disease besides genetics? And it has what I've been talking about for years now. The primary non-genetic causes of autoimmune disease, or really any kind of chronic illness, include environmental exposures such as toxins. So it says pollutants, chemicals, infections, and then lifestyle factors.
In medicine, we have a saying, and that is garbage in, garbage out. If you do not put in a whole lot of information, you're not going to get a whole lot of information out. Now, what is Open Evidence? It is an AI that specifically uses medical journals only to formulate answers to questions. But just like with what I said before, if you ask a simplistic question, you're going to get a simplistic answer. So why am I saying garbage in, garbage out?
In medicine, when they find an autoimmune disease, you end up on steroids, antihistamines, and new biological drugs. But the truth is, you got to get the toxins out, and you got to get the infections out. You got to clean up the gut. You got to take Mimosa pudica, which gets rid of ropeworms, mucoid plaques, other parasites. You got to detox, and it could be a year or two to get all the toxins out.
That reason is because you're not asking follow-up questions. Here was your question, saying about the same, but now let's expand. Next question, does removing the offending agent reverse autoimmune conditions? And the answer is, it depends. Removing the offending agent can sometimes reverse it, such as cases like drug-induced lupus-like disorders. But for the majority of problems, once chronic autoimmunity is established, that's it. It persists even after trigger removal. You're using Open Evidence, so am I. The complex interplay between genetics, environment, and immune regulation means that triggers may initiate, but the removal does not guarantee resolution. Absolutely, triggers can cause autoimmune disease, but a trigger is not a cause. But I'm not done there. Can parasite detoxes like Mimosa pudica, something that you mentioned, help with autoimmune conditions? There's no clinical evidence. So it seems like you're only using Open Evidence when it fits your narrative, not when it doesn't.
So it's unfortunate how drug-based medicine is, and the more I use Open Evidence AI, the more I realize how deficient the information is.
Oh, Open Evidence has made it the easiest to combat misinformation and expose what the research actually says to prevent this kind of misinformation being spread online. Don't get scammed. Take back your health.